It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, get peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered. And in last week's episode, I answered another question from our readers. And the question last week was part 4 of my 68-year-old mother is in ICU with gastric perforation and she's not waking up after the surgery. Will she need a tracheostomy? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another question from one of our clients, which are excerpts from phone counselling and consulting sessions with me. And the question this week is, my mum had a cardiac arrest with a hypoxic brain injury. She's not waking up and the doctors want to pull the plug. Help, part 1. So, Bree writes and describes her mother's situation as follows. Hi, Patrick. My mum was taken to intensive care after she had a cardiac arrest at home. The paramedics came late. It took them about 30 minutes to get to my mum's house. It then took them about 45 minutes to resuscitate her. Now she has a breathing tube and is on the ventilator. She's breathing, thank God, however, she's not responding to stimuli. Do you think she's going to make it? How can we help her survive? Or what kind of treatment should we give her? The doctors have not induced her into a coma. She's just lying there without any movement. Tomorrow, the ICU doctors are wanting to take her off the ventilator and basically pull the plug. Then she will be breathing on her own until God decides to take her. I have seen her and talked to her every day. I have held her hands. She has a pulse. Her body is warm. She was diagnosed with cardiac arrest and respiratory lack of oxygen. Can she be cured? Will she recognize me? I'm one of her concerned daughters. My mother is 84 years old. I do think severe brain damage can be healed given time. My mum fell a couple of times over the last year and therefore she was in a wheelchair. My sister had just finished helping my mum when she went into respiratory arrest. Then my sister called 911 and gave mum CPR. The paramedics finally came to continue CPR. Then she had the cardiac arrest. I really want her to recover soon. I know she will with advancement in medicine. The doctor said she may be in a vegetative state, which I don't agree with because it's only been about 10 days since she's been to intensive care. Her CT scan of the brain shows little damages and according to the doctors her heart is in good shape considering she had a cardiac arrest. They talked about doing a tracheostomy but it will hurt her breathing. When I visited my mum today, me and my siblings had a meeting with Dr. Smith. The doctor informed us that my mother's heart is in good condition and her brain as well. It does have some damage due to the lack of oxygen. Her brain was without oxygen for up to 15 minutes, they reckon. The doctor is rushing us to get her off the ventilator, pull the plug, or do a tracheostomy. The doctor wrote the letter so to take it to the judge to unplug the ventilator. Scary it is. My sister is afraid that mum becomes a vegetable with 24-hour caring needed. We are debating and discussing. They have chest x-ray for my mum every day. She's still not responding. Will she ever respond? And that's from Bree. So here is my response. Hi Bree. Thanks for your email and thank you for being a client and for using my one-on-one phone and Skype counseling and consulting service. First of all, you are absolutely correct to say that your mother will need time in order to recover if she can. Most critically ill patients with severe head or brain injuries will need time to recover. Yes, your mother may have had time without sufficient oxygen to the brain, and yes, she may have sustained some brain damage, but she still will need time for you to see what she will be capable of doing. There is a very good chance that the doctors don't want her recovery, because the worst case scenario from an intensive care perspective is always a bed block. It means that if they give your mother the time she will need to recover in her own time, she most likely will block a bed in intensive care, and hospitals and intensive care units, generally speaking, don't want that. Intensive care beds are in huge demand. Therefore, a critically ill patient who is blocking a bed is not in the interest of an intensive care unit. Also, you need to look at the level of support she's needing. You mentioned that she's on a breathing tube and the ventilator, and you said her heart is strong. I therefore assume she's not on any vasopressors or inotropes, which is in essence blood pressure medication. And blood pressure medication, especially after cardiac arrest, is used for supporting a weak heart to maintain a physiological blood pressure. She therefore is quote-unquote only on one form of life support, which is the ventilator and the breathing tube. If your mum had multiple forms of life support, like the inotropes or vasopressors for low blood pressure, and or a weak and decompensated heart, the intensive care team would have a much stronger argument to take your mother off life support and letting her die. I therefore would not rush into taking her off life support. You also have to wonder, why are they in a hurry to take her off life support? Are they worried about the cost, or do they need the intensive care bed? You really need to start asking the right questions in order to get to the right answers. Also, you need to start managing the negativity of the intensive care team and the intensive care doctors in particular. So how do you do that? First of all, you need to stay positive no matter what. No matter the outcome, you need to stay positive. Even if the outcome is negative, it'll still serve you to have a positive outlook. Think about it. What would you rather do? Be positive and have a negative outcome, or would you rather be negative and have a negative outcome? I know which one I would choose, that's for sure. So you also should look at some articles and videos that I wrote about this topic. One article and video, for example, is how to stay positive if your loved one is critically ill in intensive care. And another article and video that you may be looking at is 5 powerful things you need to do if the intensive care team is negative when your loved one is critically ill in intensive care. With all the information you have shared, Bree, yes, your mother has brain damage, most likely, but they are also suggesting that it's not severe brain damage. Again, it's another reason to give your mother the time she will need in order to recover in her own time. There is still time to look at alternatives if your mother doesn't recover after she has been given the time she needs. I'm talking about weeks and sometimes months. That's a reasonable time frame. I have written about this extensively in an ebook, and the name or the title of the ebook is The 10 Things You Didn't Know About Severe Head or Brain Injuries, including traumatic brain injury and stroke in intensive care, that you must know, especially if your loved one isn't waking up, or if the intensive care team suggests a poor prognosis, or even worse, if the intensive care team suggests a withdrawal of treatment or a limitation of treatment. Also, Bree, if they are so adamant to withdraw treatment, or what you refer to pulling the plug, as you have mentioned, why would they do a chest X-ray daily if they were trying and withdraw treatment? That's contradictory, and it doesn't add up as far as I'm concerned. Unless they're going to do a tracheostomy, you'll never know if your mother will wake up. The reason your mother will need a tracheostomy are manifold and are mainly to protect her airway while she's still in a coma and not waking up. I have also put some links to articles and videos below this video in the written version of this blog when to do a tracheostomy. You can check them out by clicking on the links. And again, Brie, most importantly, a tracheostomy will buy your mother the time she will need in order to wake up and recover in her own time. She will need time, nurturing, good nursing care and a positive environment for this to occur. Moreover, you've mentioned repeatedly that the ICU doctor is adamant about wanting to withdraw treatment. Many families in intensive care are finding themselves in this unfortunate situation and predicament, and they can't see it coming. Most families of critically ill patients in intensive care believe that intensive care teams are always prepared to do whatever it takes in order to get their loved ones to survive, and they are finding themselves bitterly disappointed when they see that the opposite is often true. The only effective way to counteract the intensive care team's positioning of wanting to withdraw treatment is to do your own research and engage a consultant and advocate like myself who can argue on the same level than the intensive care doctors. If you are unprepared for such a discussion and you don't know the ins and outs, and if you don't know how to position your mother's diagnosis and her prognosis, you will fight a losing battle, just like the 99% of the families of critically ill patients in intensive care are fighting. The good news now is that you are now gathering information and you are now in the middle of getting a crash course about intensive care and about how to position your mother's diagnosis, her prognosis, as well as her care and her treatment. That's the only way forward. Furthermore, given that you are in the United States, the intensive care team can't just remove life support without your and your family's consent. Intensive care teams often suggest otherwise, but if you went to court, like many families have done, courts are almost always ruling in your favor. Withdrawing life support and letting people die without seeking consent and agreement from a medical power of attorney like yourself is murder, as far as I'm concerned. Moreover, you haven't given this situation any meaning, and the reality is that if you don't attribute any meaning to this situation, the intensive care team will do it for you. Their meaning of your mother's situation is going to be vastly different from your meaning, and once again, it all boils down to you getting to position your mum's diagnosis, her prognosis, as well as her care and her treatment correctly. You will also need to change your demeanor and body language. What do I mean by that? Now that we have spoken on the phone a few times, Brie, I do believe you are intimidated by the intensive care team and you need to change it. The minute you stop being intimidated by the intensive care team, things will change for you. So, how do you stop being intimidated? Well, the first thing is you need to change your body language to begin with. You also need to change your style of communication with the intensive care team. How do you do that? Instead of the intensive care doctors telling you when to attend a family meeting, for example, you will ask them in no uncertain terms what you want, expect, and demand. 99% of the families of critically ill patients in intensive care don't do that because they are intimidated and therefore they make no informed decisions, have no peace of mind, no control, no power, and no influence. It's all in your hands and in your head. Keep asking the right questions and don't take no for an answer. It makes all the difference. So, how can you become the best advocate for your critically ill loved one? Make informed decisions. Get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care. You get to that all-important feeling of making informed decisions. Get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast once your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability, even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counselling and consulting with me via Skype, over the phone, or via email by clicking on the products tab. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.